All right, welcome. I have 4:02 on my clock. We like to start things on time here. My name is Kelly Matthews. I am the co-director of the Wisconsin Early Education Shared Services Network. We have the longest name ever, so we fondly go by WEESSN. My background is in family childcare, and I nerd out on all things family childcare business practices.
Hi, everybody. My name is Paula Drew. I'm Kelly's co-director. At WEESSN, my background is in center-based administration. So I like to think about policies and procedures and staff retention.
We are a state affiliate of NACCE, so we do not have the typical naming structure because we existed before the EEYC thing was a thing. So they actually allowed us to keep our old-fashioned name, so we're the Wisconsin Early Childhood Association. Slide's not going to move. You got a clicker? All right, no slides moving. That's great. I know, I'm going to tap, see if I tap. There we go. Were we talking about being graceful about technology earlier? Yes, we were. So we have a number of programs at the Wisconsin Early Childhood Association. We are a food program sponsor, so I know there's some food CACFP folks in the room. We are the only statewide sponsor for family childcare in the state. We serve all 72 counties. We are with Reward, so we have a stipend that is a wage supplement that rewards longevity in the field and educational achievement. We are a Teach Scholarship state, so we hold that contract to help early educators get credit-based education for little to no cost. All of those programs have been around for like 20 years. We're the baby. We started in January of 19 with WEESSN, publicly with providers. I will also mention Raising Wisconsin, which is a fierce collaboration of cross-sector folks in Wisconsin who are taking up the issue of ensuring there is enough care for Wisconsin's children and that care is not just custodial care, but quality care. So WEESSN started in, like I said, in January 19. We had 2 providers, 1 family, 1 group. That was it. I came to the Shared Service Conference about 6 years ago, knowing nothing, knowing no one, deer in headlights, going, my executive director sent me and I have no idea what I'm doing. I met some of those folks today and I talked to them and said, it's okay. People here are really nice. They're going to help. And it's true. 2 years later, we were presenting on our work in Wisconsin with rural providers and talking about how to make shared services work in rural communities with family childcare providers. We're back again because we keep growing. So we're going to tell a little bit of that story today and some of our learnings, I'll say, or mistakes, iterations, whatever you want to call them, about how we've done this work. So you've heard from the previous plenary, if you were there, you move at the speed of trust. That is one of our core foundations. We don't ask providers to do anything that we won't help them with. It is a very side-by-side model. We have helped people learn how to turn on laptops, all the way to very complex businesses, talking strategies with boards, doing financial projections. You name it, WEESSN can help. Someone actually called us the fairy godmothers of childcare, and that was the best compliment I think we've ever gotten. Our work, we think, is special because A, we listen to providers deeply, and B, all of our staff have lived experience being either program administrators or family childcare owner. So everybody in our team has walked those shoes. They understand what it is to be in that challenge of wearing all the hats all the time, doing all the things, and where those pain points can be, that will be the quickest places to touch to help programs move into a place of not such crisis. And we all know in the last 2 years that has been ratcheted up dramatically through COVID. We have a staff in the room that actually became a researcher on all things CDC guidelines and what the World Health Organization was putting out. She and a couple other folks put together a health guidance document when COVID was first coming out, that one of our counties, actually the public health department, put their name on and said, this is good, use this. Was she a trained public health person. She was not, but she is a darn good researcher. So that is the way we pivoted. Whatever providers needed in that moment, that's what we did. Oh, you made them fade in. Okay. And in a different order. Fabulous. See, WEESSN does it different. That's how we go. You're all going to remember this now. Like, they didn't do it in order. So our mission is basically we will improve quality by lowering costs and saving time. Those are our two big things. We want to save you time. We want to save you money. However we can do that is how we show up. Our vision very much pivots on those wages that we know have to be met in order to keep folks in this field. We want to reward their expertise. We want to reward their education. We want to make sure children are receiving quality care, no matter what zip code they live in, no matter what street they were born on. Because if that happens, their community will be stronger. We all know in this room that childcare is the backbone of a thriving community. Through health, through safety, through nutrition, through being economic development drivers, it's on us. We do it. And the providers that we serve are basically what make their communities work. So our values are innovation. I mentioned earlier, we make mistakes. We do it well. We do. We start small with our mistakes, though. We have learned from Louise Stoney, don't make big mistakes. Try it out, try it out, try it out. Learn with the small groups so that when you're ready to scale, you've got those bugs worked out and it feels like a much smoother process for everybody who's experiencing it. We have iterated on technology, I don't know how many times. We have iterated on delivery models several times. We broke the mold a little bit. I said we listened to providers. Louise Stoney has been our technical assistance person from before we were a thing. She is amazing. She's basically helped us be really clear about what we want to offer. She told us, whatever you do, don't start with a subpool. Do not start with that. Low hanging fruit is what you want. Okay, got it. So Louise is on this shoulder. I went out to meet with the providers in the communities we were going to be serving. The number one thing they wanted, healthcare. The number two thing they wanted, subpool. Yep. So within 6 months of starting, we had a working subpool because that's what the providers told us they wanted. What is funny about that, or not even funny, but a bit heartbreaking, is they told us when we were rolling this out, you were the only group that came back and told us what the survey results were. And you were the only ones that listened to us and got us what you gave us what we asked for. And that buy-in from the beginning was the North Star. We listen to providers and we get them what they need. So through that innovation, we bring all the communities that we work in along with us to bring those resources to bear on the providers. We are about systems change. I was talking to a couple folks and they were talking about these small regional shared services that might be happening in different places. I'm going to urge y'all to use your strength together. Know what each other is doing. Be on the same page as best you can, because our work is not small work. Our work is actually big work. And our job is to push back against those systems that are not working for providers, not working for families, and really not working for the states. And figure out what do we do and build that moves things in the way they actually need to move. Be the system that isn't there, right? We don't have a system. I got a stat yesterday that 90% of childcare programs are independent businesses in our sector. So thinking about how do we get 90% of folks moving in a way and participating in something that connects them and helps them participate in something that is going to make their lives better. And sustainability. We are always thinking about how does this keep going? Right now, I will tell you early on, this woman has written more grant proposals than some of you are old. She is amazing. We hustled so hard when we first started. We thought we were going to get $1.5 million to kick off. We didn't get both grants. We got one. We started on $400,000 and had to do everything that we had to do in the $1 million grant that we didn't get because we had premised it on this being the supplementary funding and not the original funding. So we were very smart, innovative, We've done more budgets than you can shake a stick at to make things work. At one point, our organization held 2 major systems change grants in Wisconsin through different university systems, the Medical College of Wisconsin at UWM in Madison. It was unheard of our state to have one organization holding both of them at the same time, let alone both of them being about childcare. What that told us was that people were ready to see childcare as systems change, that was the lever to actually make health outcomes better, community outcomes better, right? So this is our little history of WEESSN. We have scaled, we are moving into our 7th time. On one hand, it's amazing, it's exhausting, and it is the way it needs to be. So we started with a very small pilot in 2 rural counties in Wisconsin. We picked rural counties specifically because they often don't receive the same level of services and support that urban centers might receive. Like I said, we started with 2 providers in January. 6 months later, we had 2 providers. It's great. 10 months later, 2 providers. We were just like, what do we got to do, right? And we were hearing earlier about those cultural brokers. We had a meeting with one provider, a director out there. She's like, I don't need this. I don't need this. I don't need this. I've been doing this 30 years. I can do ProCare in my sleep. I don't need this. All right, Verna. You do professional development? Yes, I do. That is part of WEESSN. Will you come and do a session for my staff? Yes, we will, Verna. What would you like it on? Great. Here's the date. Let's do it. She signed on that day and brought, I don't know, half a dozen of folks with her. As soon as Verna said it was okay, it was okay. So part of your role is to find out who your Verna is and have a good relationship with them. Once we launched there, we then we placed in a national competition with Google money that was looking at how to help sustain the middle class from falling into poverty. And so shared services was one of 4 pillars in that project. That's when the lovely Paula Drew came on. I didn't know her at the time. All of a sudden she was doing this work and thrown into shared services, and we met, and it's been amazing ever since. After the Madison cohort grew, we then moved to Milwaukee. We received the Other Systems Change grant to launch there. We have coaches in Milwaukee who have had long-standing relationships with programs. They have worked with them for a long time. This is just another phase of how they get to work with them. So that relationship building was already in place there, which I think was pivotal. Then the pandemic hit. Remember that? We remember that, right? We were then received money from the PDG grant, preschool development grant from the state, and told basically to double in size with staff and number of counties we were serving, all virtually. No small feat. Because WEESSN values technology and we provided hardware and software to our programs, they were ready to pivot when they needed to. They already had support. They understood how to use their computers to the degree they needed to participate. What we found out is because we were offering hardware to our programs, they could then benefit from visits from their quality rating folks because they didn't have another way to get those supports to those providers. So they actually received double benefit because WEESSN was able to get them what they needed to participate. So we also, at this point, doubled in staff size. So there's actually a staff person here I had not met. I hired her about 1.5 years ago. We just met at this conference for the first time face-to-face, which is pretty cool. Oh, I'm going to tell the story. You know I am. After we added another 6 counties in the southeast or southwestern portion of the state, we then went statewide. We had a tiered model of services. We received state funding at that time, and they said, basically, with this money, we're going to push you to serve every provider in the state that wants to be part of this. We went, okay, we'll do it. And so we hired some amazingly smart people who from scratch figured out a tiered system. We have one tier with is basically what we call WEESSN, the Wisconsin Shared Educational Resources. It is the CCA for social good, but our tagline, run your business wiser. That's right. We also then moved into a second tier system, which more is like a hotline of coaching. So people receive, they can call in, get some questions answered, get policies reviewed. I heard that thing about DCF. Is it true? Like, we're Mythbusters, we do it all. In addition to that, folks receive professional development around business practices. We have a telehealth medicine benefit. There's stuff, I'm not going to tell you all that because then I'm going to steal her thunder. I'll just tell you we went tiers. Yeah?
Yeah.
Okay. After that, we then rolled out in another 4 counties, and we are moving into another 4 yet this summer. So we will be serving with our deep level of services, 20 different counties in the state of Wisconsin with access to tier 1 and 2 statewide. And we are in conversation with more counties. People are hearing about this. They're hearing about it from their providers, saying this is good for us. We like this. They actually listen and help. And they kept us open. We have a number of programs that have said if it wasn't for WEESSN, we wouldn't be open. So here's a little bit for folks who like data and bar graphs and all that kind of stuff. This is your slide. This is our growth for how we moved and doubled and tripled in size. We went from 2 programs to closing in on 1,300 this month. Yeah, I know, you can pick up your jaw. It is that crazy though. It is amazing. It is partially because we are in partnership with our Department of Children and Families. They believe in WEESSN. They have named us as essential infrastructure for childcare in the state of Wisconsin. Some states are giving out money through the COVID relief dollars and funneling it directly to programs. We use a portal system for that in Wisconsin. They actually put a little tick box on the application that said, do you want to learn more about WEESSN? And the first month of that being live, we had 550 people tick that box and say, we're interested in learning more. So when you have those strong relationships with your state, they can help you do things that you can't do on your own. So is there anything about you want to say about the data slide? All right. This is when I turn it over to the amazing Paula Drew to talk about what is the things that WEESSN does. I'm not going to trip on that.
Kelly did her master's in improv, and when we present together, I'm always like, stick to the plan. And she's like, what plan? We're improving. And I really like to practice and focus and know what everybody's doing. And then Kelly's like making me uncomfortable, like, why are you saying those words? And this is why we make a great team together. So Kelly mentioned we recently moved into a 3-tier system of support. The 3rd tier is where we started, and I will get there, but know that the 1st tier and the 2nd tier are relatively new. Tier 1 is about communication. So it's really sort of basic information sharing. It is available, it is accessible virtually, so it doesn't matter where you live in the state. And it is also available in English and Spanish. And what providers get in Tier 1 is, first of all, access to that ECE shared resource platform. And not just access to it, but training to go along with it so people understand how to navigate this giant platform full of 1,600 resources. So we do quarterly trainings in English and Spanish that highlight different parts of the platform. Janine here is one of our tiered specialists, so she heads those up, and they talk about what's happening, what's current in the sector, and what resources might be able to match those challenges. And then we also use Acquire for Hire through the ECU shared resource platform, and that is a hiring platform for anybody who doesn't know. So providers can post jobs on there. It goes out to 11 different job sites. The applicants come back into this portal, so they're not printing off, resumes and having them all over the place. They have all of the resources in one. It's free. So nobody is paying $75 to post a job on Indeed. They can do it all here, and it will go to Indeed anyways, but it's free. And then also on the ECU shared resource platform, there's a savings portal where providers can get discounts on anything from payroll to, chairs and, outdoor furniture, really anything a provider may use during their day. So we highlight the things that they can access on there, and we show them, we screen share, we show them how to make the most of those. Additionally, we do something called the WEESSN Wrap Up, which is a newsletter that we put out at the end of every month. We call it the Wrap Up because it is essentially like, okay, this was the month of April. What happened in the month of April that we feel like you really need to know about? In there, there's always going to be a highlight from the Wiser platform, but there's also going to be, hey, did you know that this licensing rule was changed? Did you know that this grant is available? Do you know about these 3 professional development opportunities? Do you know, recently this month, we did an article on the Iron Triangle. Do you know what your cost per child is? Guess what? If you don't, it's okay. We're going to tell you. And then lastly, we do a second newsletter that's really focused on food and nutrition, has recipes that are CACFP approved that you can use in your program, also activities to do with kids around nutrition. So these things are sort of themes that you'll see that these resources slowly get a little bit deeper as we go into the second and third tier. So tier 2 is also a virtual tier, so you can live anywhere and receive access to tier 2. It is also available in English and Spanish. And providers in tier 2, basically, they're getting a lot more stuff and they're agreeing to engage with us at a deeper level. So logic might say, well, if you could get all this stuff in tier 2, why wouldn't everybody want to be in tier 2? But we're asking them to engage with us at a deeper level. And a lot of people will say, I just want the information and I want to decide what to do with it on my own. So folks that come into tier 2 receive everything that they can get in tier 1. And then they get some additional offerings. So the Docs by Phone is a telehealth and telemedicine and teletherapy benefit. So providers can call in with any type of health issue, whether it's pink eye or a sore throat, and they can get a doctor. And I think the tagline is like 9 minutes or less. And they can also get a number of free talk therapy sessions per year. This benefit is available to them and anybody who lives in their household. So they get this free as part of being in tier 2. We have access to this through that ECE shared resource platform at a really reasonable rate per person. Next, we offer a deeper level of professional development in tier 2, mainly focused on financial practices. So really wanting to hone in on helping people understand their business and eventually save them time and money. We also this year have placed a focus on diversity, equity, and inclusion trainings. And really, as things come up, we're going to respond to them and pull people together to either discuss about them or bring in trainers based on what's happening in the field. So it's more of a responsive level of professional development. In addition to that, our organization, WEESSN, hosts an annual conference, which is 2.5 days of really in-depth professional development opportunities. And everybody in tier 2 and tier 3 get a free pass to that conference. Lastly, in tier 2, folks that come into tier 2 have an option to take advantage of software. Now, we used to say people who are coming into tier 2 are required to use software. And what was really interesting about this is nobody wanted to be a part of tier 2 because they didn't want to use the software. And so we sort of regrouped and we said, well, you know, maybe we don't need to make them use it. And as soon as we said, no, that's okay, you don't have to use it. You can if you want, but you don't have to. Everybody said, well, no, I want to use it. I do want it. And it's been really remarkable. I feel like we could do a whole session on theory of change and like how this happened, but we have more folks using technology now than we did when we required people to use it. And additionally, we negotiated some lower costs with our vendor so that it matches the lowest cost CCMS available. So some providers would say, well, I use this other one because it's only $10 a month. So we were able to work with our vendor to say, this is what we're hearing. And our theory is that if you can match that price, you're going to get that business because you provide a deeper level of service. And indeed, that is what's happening now. So, so folks in tier 2 get the onboarding fees and then 6 months free we use Early Learning Ventures Alliance core software as part of being in tier 2. We are working right now. We've done a lot of work with ELV in development to make this the right software system for the state of Wisconsin. We have developed a full online enrollment portal through ELV that meets our state licensing requirements. Kelly talked about systems change, and we have really taken the state along with us as we have built our network, built this infrastructure, and the state is fully aware of and understands how ELV works and what that can actually do to help with compliance. So licensors understand it, and they are excited about the fact that it can help them with their work over time. Lastly, tier 3, and this is, I mentioned, this is where we started. This is what we started doing, which was kind of the opposite of what Louise said. We started doing a whole lot of stuff at once, and then we sort of backed it out from there to make it more accessible. So tier 3 is available in certain regions of the state. And it's that way because we hire coaches and substitute teachers that live in the communities that they're serving. So folks in tier 3 get all of the services in tier 1 and tier 2. And I forgot to mention that in tier 2, you get access to sort of like a warm line for help. So Janine is one of our tiered specialist coaches. As I mentioned, if a provider in tier 2 has a question, needs support, they can pick up the phone and call. And there's 3 tiered specialists, one that speaks Spanish and 2 others that are responsive to those calls. In tier 3, the coaching looks a little bit different, in which you are setting goals hand in hand with providers that are individualized to them based on financial things that they want to get to. So whether that's affording health insurance or building a new playground, whatever their goals are, we use that to help them change their practices along the way. So in tier 3, you get a coach that lives in your area, that has worked as either a center director or a family child care provider themselves. Every single one of us on our team, including Kelly and I, have been either a center director or a family child care provider. And if you're coaching family child care providers, you have been a family child care provider. If you're coaching center-based directors, you have been a center-based director. We feel really strongly about that. And I honestly feel like that's been why we've been so successful with our work, is because we come with that inside knowledge of real life experiences in the field. And it sort of, it enables us to come with a little bit of trust already, because people know that we've been side by side with them. So our relief squad, our substitute teacher pool, those folks we hire, they're on our staff and they work across the network of programs we serve in those regional areas. We feel like this works best for us because we can really control the quality. And we also know that it works best for family child care providers, so they don't have to pay employee taxes when they want to use a sub 2 times a year. Additionally, we do have financial specialists who do any number of back office supports with programs. So whether it's just setting up automated billing and receiving, or running the whole sort of like billing and receiving and report making and other financial words that aren't coming to my mind right now. So they essentially call our financial specialists or are connected by a coach. And those folks will go really deep with programs who want to create a business plan so they can get a loan. They want to say out loud, I have this budget on paper that I use when, the QRS woman comes in, but it's not real and it's not helping me. And we say, that's fine. Like, that's okay. Let's sit down. Would you like to make something that does actually work for you? And so those are the types of things that we do within our back office. And I will say, it's not necessarily what we thought it was going to be when we started out. We thought we would be doing the full back end supports for all of our programs. And that really is not how it's turned out to be so far, because people aren't really interested or willing to that degree. We do have some, and they are actually saving a ton of money. But for a lot of other programs, they're building that trust. They're learning that they can trust this team of supports with whatever task that they bring. And then a next thing that we offer is deep food system support. So because we do this regional model, we are connecting to producers and food systems in these communities and getting the early care and education programs connected to those food systems or bringing them to the early care and education programs. We know specifically through the pandemic that access to nutrient dense foods was really difficult for providers to gain. That's actually how this came about. So pre-pandemic, we didn't do much in the sort of like food systems role. But during the pandemic, especially our providers in Milwaukee were having a very difficult time accessing the amount of food that they needed to serve their kids. And so we responded to that and we wrote some side grants to get some food immediately into programs. I think we did this big project that was like 23,000 pounds of food or something that went out to families and 65 providers in 2 cities, and every family they served and every staff person they served during sort of the height of the pandemic. And that led us to say, we need a coordinator that is going to work in community to leverage opportunities and connect to producers on behalf of providers. And what we've learned in doing this is that also farmers are in a very similar boat right now where they don't have staffing and they are sort of struggling in some similar ways. So this is strengthening communities by making these touch point connections. And I mentioned the coaching already, but I just want to say again, all of these things that we offer, the coaches are the most important part of our programming. On paper, if you go to our website, it says, your coach will help you with these individualized financial goals and budgeting. In reality, they are doing really complex, deep work with providers, and sometimes they are doing crisis intervention. More and more these days, they are doing some pretty significant types of crisis intervention. And we are told, time and time again, like, I don't know that I would still be here if it wasn't for my coach, like picking up the phone when something tragic happened next door to our program that everybody on the playground witnessed. I don't know if I'd still be here. If somebody wasn't there just to listen to me, like talk through this problem that I wasn't sure how to solve. So, we have a lot to offer, and we have a lot of resources. We do deep community work. I don't know that Kelly touched on this too much, but the map that we showed you, all of those regional areas that Tier 3 is operating in, we are only there because we've been asked by the community to come and provide this service. And not only that, but then we reach out to providers. Kelly mentioned the survey, and then we do focus groups to say, is this something that would help solve any of your problems before we ever start working in a region? And in that way, we can bring community partners engaged in this challenge locally together to say, here's what the providers, here's what we're learning their challenges are. What assets are available locally that we can help leverage on behalf of programs, so that deep community engagement isn't necessarily on our suite of services, but it's something we're deeply engaged in. And I would say half of our time, Kelly and I, half of our time is in community meetings all over the state, being that sort of like sounding board. Did you know that this community has tried this? I could connect you with that leader to see if this might work here. Bringing providers to the table to say, you economic development folks are really smart and these are some great ideas, but let's get a few childcare providers at this table to see if this is what they want or this is what's going to help them. So with that, I'm going to pass it. Okay. Yeah. Sure.
This person wanted to know about how many providers are at each level.
Yeah, that's a great question. I'm going to do this by memory. Janine actually do know.
Yeah, speak into the mic, please.
Yeah.
I believe the numbers as of this morning, we had about 193 members in Tier 3, 95 in Tier 2. We have a limit in Tier 2 of 150 providers. So we're almost to our limit there for Tier 2. And at Tier 1, our goal is 3,000 providers, and we're already at 1,200, just over 1,200. So And that's just since starting in September.
Thanks, Jean. 193.
And also, Paul, I just wanted you to give them a sense of budget, like what's happened to your budget between when you started and now.
That's an important data point. And I'm going to say one other thing about the numbers first is that what Janine was mentioning about our limit is each of our coaching staff has a ratio of how many providers they're serving. And in some regions of the state where we know providers need additional help, those ratios are lower. And in other places that are more resource heavy already, those ratios are lighter. But in generally speaking, our tier 3 coach serves 20 programs. A tier 2 coach, we're actually still learning. At the beginning, we were like, yeah, it's just going to be minor calls. So each one will serve 75 programs. And that is not true at all. Turns out that people who haven't had a lot of support need a lot of support. And so we're hiring more tier 1 and tier 2 coaches to meet that demand. And so if I had to guess, I would maybe say like 1 to 35-ish for tier 2.
Between 35 and 40.
Right. Yeah. Okay. So it sounds like for tier 2, it's probably going to end up being 1 coach per 35 to 40 programs. Louise mentioned funding because I think this is a very critical point to say is we have been incredibly fortunate with funding. So all of these services are free to providers because we have been working our butts off raising funds. Kelly sort of gave you the history of different funders that believed in what we were doing and helped us to get started. After we got the PDG grant, we just really did a good job of telling the state what we were doing and how that was helping them. And in January of this year, last summer was when we got the first. Okay, so January of 2021, the governor of Wisconsin put out a press release that said that he was dedicating $5.5 million to shared services in the state of Wisconsin, and we hadn't heard a thing about it. And we were like, wait, what? And so a year and a half later, we are operating on a $5.5 million budget. And next year, actually, we will receive additional funding up to $8.4 million over an 18-month period. So the map that you saw and the graphs that were going like this are probably going to keep going like this. And that's exciting because we are building an infrastructure that wasn't there before. We are changing systems, we're listening to providers, and we're providing as much support as we can. We're not silly enough to think that this money is always going to be there, but while it's here, we're going to do as much good as we can with it. Pass back.
There were some other questions, I think. Yeah.
Thank you. That was really great. My one question was, could you break down that funding? Because I thought there was business input into your model as well. Is that correct or incorrect, or are these all federal/state dollars? I was wondering if you just break that down.
So our start was philanthropic, PDG, and then 2 rounds of COVID relief. So CURSA and ARPA. Our state dedicates pretty much zero money to early care and education. No, we have I could talk your ear off for hours about a plan I have. If somebody could give us some money, how to leverage slots across the network with business investments, but maybe next time we come back.
But hang on one sec. You did get some business support early on from like Organic Family Food. You want to talk a little bit about that?
So I can tell the very, very, very beginning of the story is I was employed by WECA, not doing shared services, but we were getting invited to a lot of conversations about shared services in that western part of the state. We were part of roundtables. There was a childcare discussion that 130 people in that 2-county area, which is not very populated, show up to talk about childcare. There was business in the room, the hospital, the school districts, the libraries, everybody was there. Out of that came the community plan of let's try shared services. So Organic Valley actually paid my salary to write the first proposal. They put money on the table and said, if we're going to do this, we're going to do it. And so we were fortunate to win that first grant and kick it all off. But so if you ever buy Organic Valley food, you can feel really good about that. They really care about childcare. Along the way, we have had local businesses create discounts for our providers across the state. So we have that piece. We have also written mini grants to some of our community supporters. So the hospital actually has donated over $4,000 for technology supports because they understand why you need technology to run a business, right? You can't still use paper files. We've had other folks do sort of like micro grants to us to be able to do different parts of our network for the providers. So it has been very large entities down to hyper local entities that we've brought along with us. I'm gonna go, oh, she's got the mic. I have no power to say who goes next.
Oh, thank you. Two questions. The first one is, are there requirements for providers to join the shared services?
Yes, they
And
have
the-
to be regulated.
Regulated, that's the only one?
Yep.
I know you touched a little bit about adoption and the technology piece. Kind of how do you're presenting all these great platforms, and then, they don't want to put the work or that investment up front, or maybe they don't see the value. So kind of was that work that allows, providers to go from paper and pen to, software and technology? And then the last question, promise, is the sustainability of the program. We talk a lot about, getting the funding, but are there any cost valuation to say, can this program be self-sustaining? And what is it going to take?
So I'll do that one first. We are actually going through a full proof of concept evaluation with Co-Create out of the School of Human Ecology at the University of Madison, Wisconsin-Madison. So they are doing time studies with us. They are interviewing providers. They're looking at all of the services that we provide. What does it take to actually run all of those services? And they are also tasked with coming up with multiple funding models so that when those other dollars are not there anymore, how do we break down those costs between providers, entities like a county or a township or a group of counties to come together with other dollars then through other grants or philanthropic dollars. So we are working on all of that. For technology uptake, oh goodness, our very first vision was so wrong. It was so wrong. Chanel is laughing because she has done a lot of our technology work onboarding with folks. We thought everyone's going to take up technology right away. It's so good. Why wouldn't they? And they were just like, no, thank you. If we have to do that, we won't even be in shared services. And we're like, okay, that's not what we want. So we dropped the technology requirements and have made them optional all along the way. And some folks who started out in our very first cohort are just now saying, I think I'm ready for ELV. Let's have that conversation. So you want to make it mandatory because you know how good it's going to be, but don't make it mandatory because then they don't like it. Nobody likes being told what to do. We doubled up when we stopped requiring technology.
Interesting.
So you do it through the goal setting and you do it through the relationship. If it feels right for the provider and they're ready, we have a full service onboarding for our tech system.
I don't have a question, but
Love
just
it.
want to say thank you for saying that about the technology piece and like when you make something optional, because history tells us, and I know listening to our providers, we do not want anyone to tell us what we are to do anymore. That's been the history, and what they want is to inform us as to, of course, what they need and what they want and have options. And so I just love that you said that so strongly.
Little curtsy there. There you go.
Thanks. Dan Harris, Illinois. So I'm familiar with some of the software packages in this space, but not the one that you're using. So, but presumably you're sitting on a whole lot of provider specific data as a result of this effort. And I'm wondering if like that is, and if it's just, if that sits only with you, or if that's shared with the state, or where I'm getting to is if any of that data, because it's really valuable, right, is used in, or is envisioned to be used in policymaking decisions, et cetera.
So at this point, we are able to share sort of anecdotal trends with the Department of Children and Families, and we do it often as a way to help them see any unintended consequences of any policies that they've put in place, like, oh, you thought it was going to do this. This is what we're hearing and seeing with these providers, so that you know that. Our software holds the data. We see dashboards, so we can access some of that. We are having conversations with other technology vendors to say, how do we now make all of this talk to each other, give some of it to the state where they need it, get something from the state where we need it, so that, because in Wisconsin, we actually don't know in the day-to-day how many children are in each spot. And that is ridiculous, right? And so we are pushing to change that, and that's on our list of like, yep, WEESSN's gonna do that. We're gonna figure it out. So we'll let you know. I have your card. Is there another question?
Hi, I'm Louise from the Women's Business Development Council in Connecticut, and we work with a lot of providers providing business education of no cost to them in partnership with our state OEC. So really doing this work and hearing the stuff you're doing with your alliance. So with the tier 3, I'm just curious about, is there one of those benefits that's really drawing people in, understanding that technology is often the barrier? They don't want to start with that. Is it the back office? Is it the coach?
It is the coach. 1,012%. It is the coach.
Okay.
They build that relationship. They, before COVID, could go on site. They do virtual visits every 2, 4, or 6 weeks or more if needed. They have done, like Paula said, some serious crisis intervention where like something terrible has happened. You can't call your food program person. You can't call licensing necessarily. They can't help. They can like tell you how you might be in violation because that thing happened. There's like nobody to call for that stuff. And so our coaches have handled some heavy issues that have come up for programs, but not just like from the compliance side, right? So it is like, let's take care of this thing. Let's take care of any HR stuff that needs to be done. Let's document whatever we need to document, tell whatever agency that we need to tell. And then they sit down with them and say, how are you as a human? You okay? Do we need to get some other additional supports, therapy, that kind of stuff going on in here? And then they say, and now what policies and procedures do we need to create that weren't in place that will help this from happening the next time? So it really is a multi-level of support that is completely customized to what that program needs.
Thank you.
Question?
I have a question, but it's also really kind of a clarification to make sure that I heard correctly. So if all of your services are free, why would they not choose tier 3 always? I mean, is it because you only have, because it's regional?
Yes.
Okay.
So tier 3 is regional. It is by invitation where we come into that county or group of counties, and then we are limited by the caseload of our coaches of how many coaches we can hire to serve that area. The only things that providers pay for in all of this work is at tier 2, after their scholarship for ELV runs out, they
6
have to pick up the ongoing cost for that. And for Relief Squad, they pay $10 an hour when they book to cover a little bit of the costs, but it doesn't come close to covering all of the costs. But then it just helps them have some accountability so that they're not canceling or abusing the system or anything like that.
Hi. Are there any qualifications these coaches have to have in
Oh,
order
yes.
to,
Oh,
can
yeah.
you share some of those?
Yep. So they have to have degrees, and they have to have 5 to 7 years experience if it's an associate's degree. If it's a bachelor's degree, they have to have 3 to 5 years experience. They have to get through us and our interview, which is no small thing. They have to have demonstrated success in their programs to be able to be considered. So we go through program licensing violations during their tenures to see what was going on in programs. We do some deep digging to make sure that the folks we hire are folks that can handle this work.
Kelly, I'm going to ask you and Paula to tell a little bit about your failure in hiring coaches. What did you learn when you hired? You had to learn that you needed coaches that came out of the early childhood field.
So one of those happened because we hired somebody from the banking industry that we thought was going to be great because he had a little bit of education background. He had been a teacher. So we're like, okay, you get it. Because he had not come from the field, the whole thing sort of came off as like used car salesman, like trying to like upsell you on something. And that's just a gross feeling when it comes to finances. We were able to find a back office person who had actually done back office services for their childcare program for over a decade. And that program then came on board with us for back office services, so they didn't lose that service. And so he has been in this field, he understands it. He's been doing deep learning on family childcare to make sure he can access and do that piece. Is there another coach story that I'm supposed to tell?
No, I just remember Paula saying that we learned that we thought we could recruit people in that were good at business. And what we realized is that we needed people who
The
knew
lived
early.
experience makes it. That is the secret sauce.
Just to tack on to that, so they definitely have that lived experience in early childhood, and that is critical. Are you training them in business to be more effective?
So
as
during the interview
coaches?
process, we ask them some questions that if they get it right, we know that they are doing solid business practices. If they don't get it right, we know there's no way they're going to be one of our coaches.
Got it. Thank
So
you.
we do some weeding out during, so we've had people that have been amazing candidates and they answered that question wrong. They don't make the cut. Is it? There's more. Oh, yes. I'm also supposed to tell you about our Build It Strong series. So we worked with a community partner to develop a 16-hour business practices training series for pre-entrepreneurs and new entrepreneurs into childcare. So it covers all the things that nobody tells you that you have to do when you try to open a business because you like kids. So how to write a legally binding contract, how to write a budget, how to write strong policies and actually enforce them, staffing well-being and how to plan for that. For family childcare, we have a special pullout session that group programs go in one session and family in the other to talk about the specifics of those different settings and what you need to know. All of the record keeping that the state requires, and how do you create systems so that you can successfully track all of that. So we did that course. We started with our community partner in Greene County. We got through course 3 of 8. And we got a phone call from the Small Business Development Center and the extension office to say, we hear you're doing this. We hear it's really amazing. Can you please take it statewide and do this like 50 times in like the next 2 months? And we said, we can't do it that much, but we ended up presenting in every one of our licensing districts in like the next 4 months. And it is taught by a coach who has a family childcare experience and a coach who has center-based experience. So that is also available. 16 hours. And it's available in Spanish. We have live translation, or we have translation for all of our slides and interpretation for every class we do. And our coaches what? Oh, yes. And our coaches watch that when they start. There we go. Thank you.
Thank you so much. I had a question for you. On your slide, it talks a little bit about, and you've hit on a lot of these points in your presentation, what has been the key to your success and the rapid growth you've had. I was hoping you could talk a little bit more about flexibility and some of the places where you have pivoted over the last couple of years, and if there's anything else that you haven't hit on yet that you felt like was really critical to your success.
So I think that is really important, this concept of flexibility, and what you think is going to be the thing is likely not going to be the thing. And you're going to know because providers are going to tell you, and you can choose to listen to them and to pivot, or you can just keep saying, well, this is what we do. Or things happen, right? Pandemics happen, other things happen, and you change what you're doing to respond to that. And when you do, you're still meeting their needs in the way that they need you to meet them. And we're lucky that we have a team, a quite large team at this point. I think we're at 25, 30, and everybody, we come together on a very regular basis to discuss what's happening in the field, to hear case studies, and to talk about ways that we may be pivoting as a group. I guess I won't share another story. I shared the food system story earlier, but just in the essence of time. One thing that is happening in the future that we haven't mentioned yet that is exciting and really sort of in response somewhat to the staffing crisis, though it's certainly not going to solve anything, is we'll be implementing an employee assistance program. Any provider in any 3 tiers and any employee that is in a program in any of the 3 tiers will have access to this employee assistance program that will be, we will be connecting with a vendor to provide the services, and then likely adding on a few additional services that we think the field needs, but that aren't offered through a regular EAP provider. So that is something brand new that we're just right now learning about. We don't know a ton about it, but we do have a sense that it's something we could do within the network. You know, some things we just can't do, and some things we can. This is something that we can do that might help with retention. Sure. Do you want to?
You can keep going if you're continuing to answer.
There's two other things I think are important to share with us, because these are two groups of folks that help us think about what we're doing. One is called the WEESSN Innovation Council. This is stacked with people smarter than us about all kinds of things outside of early childhood and inside of early childhood. So these are folks from the national sphere, from the state, and from local level partnerships that are in different sectors that have bearing on sort of what we're doing. They might be researchers at the university, or one new partner of ours is a credit card processor. We've actually negotiated a deal with them and our software company to have lower costs for credit card and ACH withdrawals through that software system. So he's now on this Innovation Council helping us think of other things we can do like that. So the WEESSN Innovation Council, and then the second group called the Voices of Providers, just stacked with providers, family and group providers from all 5 licensing regions of the state. We do compensate them for their time to be on this panel. And those two together help us think about what comes next, what we're doing now, how we can do it better. And they vet ideas past each other. So we decided against putting 1 or 2 providers on this group with a bunch of other people, because we didn't want their voices to get lost. We wanted their power to really be able to say, like, look, we get that the Innovation Council thinks this is a good idea, but we do not have the bandwidth to think about how to implement this right now. So we sort of do this iterative cycle of feedback loop, you know, between the two groups. And this is new for us, and it's really exciting. And I think it's going to lead to really great, creative, iterative thinking in terms of the services we offer. I mentioned a little bit about language work that we've been doing. This is something we started doing back in September. I would say we are at if this was the beginning of our journey, we're probably like here. We've made a lot of mistakes. We've done things stupid ways. We've learned, we've taken great feedback. We've done better. We continue to iterate around language equity to make sure that we're hitting the mark, not only linguistically, but culturally, that things, meanings of words are conveyed in the right way. We've, same thing we did with softwares. We've, tried one company that was not working out. What was their translation for docs by phone? Oh, documents by phone, which is clearly not what that is. And we're learning how to do it right. We're hiring people on our own staff who are native Spanish speakers who work in early childhood to help us lead that. And they are at the forefront of leading that work. Another way we focus on equity is we double down on resources and communities that need it most. So I mentioned sort of that coaching ratio is different in regions of the state where there are just less resources and more needs. If we have additional funds for a side grant or something, we're definitely always going to dedicate those to a few regions of the state where we know providers are not getting enough. In anything we do, that's just part of our work. That's how we think about our work. And then we're really just trying to learn about other communities that we're not serving right now, and how or if we can serve them. Is what we're providing relevant to the needs of our tribal early care and education providers? Is it wanted? Are some but not all services wanted? And so we're in conversations. We're also connecting with some really cool provider groups from around the state who are powerful in their own right, who are owning who they are, and we are engaging with them to see what can you use of ours that will help you in your work. And that's also something new and very exciting for us. And I think we've mainly touched on most of these things. So these are sort of, there's the things that we do every day, and then there's the things that we're planning on doing at some point. These are some of them, our evaluation efforts and our sustainability planning. We are deeply exploring different tax type of supports with different vendors, and we are looking at an accreditation model for family childcare providers that was born in Wisconsin, and we're targeting towards people who don't participate in the quality rating system in Wisconsin to see if this sort of relational model of accreditation is something that providers are willing to engage within, and then they get an automatic 4 or 5-star rating on the quality rating system, but they can get there in a different way. So that's a small pilot we're working on right now to just say, what if, we tried it differently, and what would that tell us that maybe then would tell the state something about the way that works. And this is our contact information. Thank you all so much for coming to the session at 4 o'clock in the afternoon. Louise switched up our time at the last minute, and we were like, what, 4 o'clock? Who's going to come to that? But you all did. So thank you so much.
Thanks.